直播已经就是开始了，就是我们可以。
Hello, everyone. Can you hear us? Our live show will be start in 5 minutes. Our engineer is preparing the instrument and the products what we are presentation today. Today, we will introduce our valuable locking plate for tibial and fibula. This is advanced plating system, which is designed for complex fracture of tibial and fibula, offering superior anatomic fit, surgical flexibility, and strong fixation. Over the next few minutes, I will show you the 6 plate types and the locking screw system, the indicated instrument set, and the key steps of the surgical technique. Hello, everyone. Steven, are you ready?
Yes, I'm ready.
No, you can.
Okay.
Hello, everyone. Welcome to CZ Meditech Media Channel today. I'm Jessica, and this is my partner, engineer Steven.
Hi everyone, I'm Steven.
Today, we are excited to introduce our new product, the valuable locking plate for tibial and fibula. Okay, let us to introduce our implants.
Okay.
We produce the 6 type of the locking plate. The first one is Proximal lateral tibial valuable plate, which is belong to 3.5 millimeter valuable locking system. Proximal part designed in double row with 3.5 locking screws. Provides excellent support to the tibial plateau, helping prevent post-operative joint collapse. They are available in 4, 6, 8, and 10 holes for the both left and right side, totally 8 types. Okay, the second is the distal medial tibial valuable locking plate. The distal end is with the 2.7 millimeter valuable holes.
2.7 is the area.
The shaft combined with 3.5 millimeter locking and compression holes. The size from 4 to 12 holes, totally 10 types, also including the left and the right side. The next one is anterior lateral distal tibial locking plate, which is combined with the 2.7 and the 3.5 millimeter system. Same combined designed as a middle plate, but shaped for the anterior anatomy. Also available in 4 to 12 holes. Left and right side, 10 types. The first one is posterior distal tibial plate. We designed for the T type and L type. They belong to 2.7 millimeter system, combined with the 2.7 valuable locking screws. T type and L type is both for the 4 and 6 holes, also left and right versions. The next one is the lateral distal fibular valuable plate. There are two elongate holes on the shaft. This allows feasible options for densitomotic fixation. Use 3.5 mm cortical screws, or combined with our tie chop suture button system. Stephen, please show. This is our suture button system. Okay, we will introduce our plates' key advantages. These universal plates all have excellent anatomical features which can closely adhere to the bone surface and promoted to the restoration of the bone's ligament. The upper surface of the plate is designed to be rounded, causing minimum circulation to the tissues and reducing the discomfort of the patients after the plate is implanted. With the fully universal hole design, there is great flexibility during the operation. The adjustable angle screw can provide more stable fixation of bone fragments in clinical practice. The next, we will introduce our screws. The entire system is divided into 2.7 and 3.5 versions, and this is compatible with 2.7 and 3.5 universal ball hand locking screw. The locking can be performed at any angle within a 15-degree range on the side of the axis line of the universal hole. The 8-shaped combination holes in the shaft part of the plate can be also used in conjunction with 2.7 and 3.5 cortical screws. The next, we will introduce our indicated instrument set. This set is mainly designed for implantation for the 2.7 and 3.5 valuable screws. There are two trays. The first tray is mainly used in conjunction with 2.7 screws, while the tools on the second layer is used for conjunction with 3.5 screws. You can see there is a yellow line on 2.7 locking screw system, which is easier to indicate when making surgery. Stephen, can you show the 2.7?
Yes.
The instrument, there are yellow line of the instruments. Okay, we also prepared the sterilization box with 2 layers for all implants and the screws. Okay, let's start the presentation of surgery operation today. The case is with the proximal lateral tibial plate. Our engineer is choosing the right side. This is belong to the 3.5 mm valuable locking system. Proximal part designed in 2 rows with 3.5 locking screws. Provides excellent support to the tibial plateau, helping prevent post-operative joint collapse. We designed for 4, 6, 8, and 10 hole lengths, and also we could customize for the 12 holes. If you need, you can send the message to us.
准备开始了，对吧
We choose the 8 holes.
？Yes, 8 holes. It's the right.
This is the right side.
Yes.
First, effectively fix the injured body part and the representation of the broken bone fragments.
You can fix.
After cutting through the skin, select the suitable length and the fixation of the plate and insert onto the bone surface. Hello everyone, welcome to watch our video today. Our engineering is using K-wire to temporarily fix the plate onto the bone surface. We must make sure the position is correct under the X-ray machine. In our set, we prepared 2 pieces of the dry bit. Diameter is 2.9 for the 3.5 valuable locking screw.
So we fix the proximal variable and locking screw first.
After the plate fixation, the plate is in the correct position, the screw in the screws for the fixation. Fix the proximal holes. Insert the end of the guide device universal hand into the universal hole. And freely choose the insertion angle of the screw bottom hole along the hole. Choose a suitable angle to drive the dry bit in. We are using our power tools to make use the dry bit to make the hole. And fix the Proximal hole. Insert, measure the depth. Select the right length of the universal lock screw.
55.
We choose what length?
55.
55. The length of screw is 55. This is, we will use our self-holding screwdriver to screw it into the hole.
Fix it. Just doing this there.
For the Proximal double row screw holes, all the screws need to be tightened to achieve a better supporting effect on the tibial plateau.
I'm not gonna fix it.
Just fix it. And finally, we will make the torque wrench to make every screw is tightened. Steven is repeating the same steps one by one. Hello everyone, need to be patient. Steven is making the hole one by one and then make the
65.
They will choose the 65, the length of the locking screw. This is our screwdriver, which is self-holding function. The screwdriver is the T15 Torx hand screwdriver. If you have any question or inquiries, please leave the message to us. Our professional sales team will reply to you at once.
We can also use this fixed angle drill guide for the neutral angle fixation.
If the locking screw inserts a fixed angle, the direction end of the guide can be inserted into the holes, providing two types of direction guides: insert type or screw-in type. You can choose freely. The instrument we are using now is all included in our instrument set. Which is the length of the screw, Steven?
75.
Okay, this is the 75. We just fix the locking screw of the double row.
We will fix the next one. Use this screw. Fix the angle.
Fix the angle. Use the dry bit again. This part is very important. It is better to make the double row holes with all the screws. The length of screw is 77.
75.
Okay, 75 the length.
但没关系。
Every time we use the depth gauge to measure the depth of the hole, select the right length of the locking screw and insert into the hole. For the Proximal double row screws, all the screws need to be tightened to achieve a better supporting effect to the tibial plateau.
We can also use this double guide drill.
Yes, this is the double head of the drill.
Yes, for the fixation. Okay.
Yeah.
Hello everyone, welcome to our channel again. If you have any question, you can leave the message to our sales team. The depth is 70. CD Meditech is founded in 13 years ago. We specialize in manufacturing orthopedic implants and instruments. So if you have any question, you can leave the message to us. We are introducing our new plate, variable locking plate for the tibial and the fibula.
We're going to use this torque wrench.
Okay, this is a torque wrench for the 1.5 Newton to tighten every one. make sure they are all tightened. You can hear the click sound. Okay, there are last 2 screws. Yes, every time you can hear the click sound, it means that it is tightened. Okay, the next, we will, after the proximal part is completely fixed, if the pressure is needed, a 3.5 cortical screw can be screwed into the part of the plate body near the fracture line to apply moderate pressure to the fracture line.
Yes, we are going to use this drill guide for the cortical screw 3.5.
Yes.
And one side is 2.5 drill bit for the drill bit.
The one side is for the drill bit.
Yes. And the other side is for protect the tap. If we need to use the tap, and then we can use this side.
And use another side.
Yes.
Okay, we are use the dry bit to make the hole. Is ready for the 3.5 cortical screw. We measure the depth.
It's going to be 34.
We will use 34, the length of the 3.5 cortical screw.
Normally, we need to use the
We will choose another
tap.
the tap of the HA 3.5.
Yes.
We prepared this tap 2.5, which is for the 3.5 cortical screw. All the instruments we provide in our instrument set. Which is for the pressure, a cortical screw is screwed into the part of the plate body near the fracture line to apply the moderate pressure to the fracture line. The cortical screw is in yellow, the color is yellow, so it is easier to indicate the find from our screw trail. We are using the K-wire
To take the K-wire out.
to take the K-wire out.
For this fixation.
Okay, the next we were using the guide wire
Yes. The shaft.
to insert the holes for the locking screw. The lock screw is a shaft. Shaft end should be inserted in the neutral position. Which is the length.
28.
28.
Locking screw.
This is also 3.5, the valuable locking screw. The length is 28. We repeat the steps. For this prison, Stephen chooses the cortical screw. At a location close to the fracture line, it is not necessary to insert all the locking screws to prevent pressure concentration. One can choose not all use screws at all. Hello everyone.
It's a cortical screw.
Yes, the yellow one is cortical screw. The green one is for the 3.5 variable locking screw.
We fix another locking screw.
Yeah, the next one we will choose the locking screw. Hello, I saw your questions. What is the length of the plate? You can check with our sales team. Yes, we have different lengths of the plate. We have the specification from the 4, 6, 8, 10 hours, and also customized for the 12 hours. Okay. Let me answer your question. We have the width is 14.2 and the length from the 87 to 177. The 4 holes, the thickness is 3.8 and the length is from the 87. The 6 holes, the length is 117. The 8 holes, the length is 147. And the 10 holes is 177. The length. You can also contact our sales team for more details. Okay, Steven is finished the Proximal, the plate. Okay, we will start the next one, the distal fibular plate. The lateral distal fibular plate, there are 2 elongated holes on the shaft. This allows flexible options for syndesmonic fixation with 3.5 cortical screws or combined with our tie chop suture button system. The size also from the 3, 4, 5, 6, 7 and 9 holes. For the left and right side, totally 12 types. Okay, we will start the presentation. The first one, use an oral reposition forceps or K-wire to reposition the bone fragments at the fracture site. Select a suitable length of the plate and insert it onto the surface of the fibular bone. Temporarily fix with the K-wire and confirm the position of the plate under the X-ray machine to ensure it is in the correct position. Okay, we are using the oral reposition forceps now. Which is depend from the doctor's habit. You can use the K-wire and or the forceps.
It's okay.
Okay, confirm the position of the plate under the X-ray machine to make sure it is in the correct position now. Then perform the distal fixation. The distal end of the fibula has a normal hole. This is not a valuable hole. This is a normal one.
For 2.7 cortical screw.
Yes, and this is for 2.7 cortical screw can be used to pressure the plate body hand against the body surface. We are using 2.7 valuable guide and the direction guide to complete the locking of the remaining holes at the distal end.
Depth gauge to
We are making the depth and measure the depth. We choose the 22 length of the 2.7 cortical screw.
use the tap for this.
Now we are using the tap. The tap is 2.0 with a guide.
Yeah, 2.7.
Yeah, we are choosing the length of the 22, the 2.7 cortical screw for this part. The distal part. Then perform the distal fixation. The distal end of the fibula has a normal hole, which is complete now.
We're going to fix the variable angle screw.
Yeah, we were using a 2.7 variable guide and the direction guide to complete the locking of the remaining holes at the distal end. Hello, everyone.
Slow.
Hello, Alex. Welcome to follow our channel. Hello, Elena. Where are you from? Yes, we are making the display of the fibula. This is the distal fibular plate.
We can also use this neutral guide for a fixed angle.
Which we will use the neutral fixed guide for the cortical screw.
No, just for the locking screw.
Oh, this one is for the locking screw. Sorry. The depth?
18.
We will choose 18 millimeter for this locking screw. Okay. Okay, this is our screwdriver. Screwdriver is the self-holding function, and for the 2.7 locking screw, the color is purple. You can easier find from our screw tray.
You can also use this guide.
We're using the dry bit to make the hole. And the depth?
18.
Also the 18. This is the purple screw for the 2.7 locking screw. Okay, we will choose the available locking screw again. This one is for the 20 millimeter. Okay,
Yes.
this is also the torque wrench for the 0.8. You can hear the click as well. .8 Newton is for the 2.7 locking screw. The 1.5 Newton is for the 3.5 locking screw. Complete the locking of the remaining holes at the distal end. Then we can start make the holes in the shaft part.
So we're gonna fix cortical screw first.
We start with the cortical screw first at the end of the shaft.
Yes. To put the plate close adhere to the bowing surface.
To make the fix of the end of the plate. Either 2.7 locking screw or cortical screw can be used for the fixation. We choose the 15, the length of the cortical screw. The cortical screw is in a yellow one. So we prepared the 3 colors of the different types of screws. 3.5 locking screw is in green. The cortical screw are all in yellow. 2.7 variable locking screw is in purple. Then remove the K-wire. For other part, either the 2.7 locking screw or cortical screw can be used for the fixation. We choose the 14. 14, the 2.7 locking screw. For the distal lateral fibular locking plate, we prepared 3, 4, 5, 6, 7, and 9 holes for both right and left. The plate length is from 79 to 157. If you want to know more details, you can leave the message to our sales team.
We are going to fix the tibial and the fibula.
Okay, the next choice, the middle of the section of the plate have the 2 long holes through which the tibial fibular bones can be fixed with 3.5 cortical screw, achieving flexible fixation of the tibial fibular joint. We'll make the hole from the fibula to the tibial. For this tibial plate, which is also combined with our suture button, Steven is measuring the depth.
50.
We choose 60 millimeter and 54. This part is using 3.5 cortical screw. Now we are using a tape. The 2.5 the tape. Which is a connection from the tibia and the fibula, so the screw length is a little bit longer. This part is 60 the length of the screw. Hello, Dr. Jan. Welcome to our channel. Thanks for watching our live show today. Thanks for your comment. Yes, it is excellent. the live show.
下一个你上去吧。打就打了，下次不打死去，不打死再来，受不了了。
We can choose that tap and also with the screw into the from the tibial to fibula to tibial.
你公司那个嘛，
来放。
你公司那个软件。
For the surgery, the operation, so we asked for the doctor needs the muscle. Okay.
Yes.
We finished the screw. This is the suture button. We also provided these products for the sports medical. The locking plate combined with the suture button.
Another choice.
Yes, another choice. We don't display this suture button today, but you can send the message to our sales team. Yes, thanks for the Steven to share the fibular locking plate to us. And this one is the proximal lateral, the tibial valuable locking plate. The mold is the right side. We also provide the left and the right side. You can see more clearly about our locking screw, different types of the screw. The purple one is a 2.7 locking screw, valuable locking screw. The yellow one is a cortical screw. Okay, this is the 8-hole right side for the proximal lateral tibial locking screw. Double rolled design as a distal. The proximal, the hand. The green, the locking screw, is for the 3.5 millimeter. Okay, thanks everyone. The introduction is finished. Welcome to follow our channel today. If you have any other questions, please leave the message or send the inquiries to our professional sales team. See you next time. Bye-bye.